in doing this, recognize that heart disease is one of throughout the nation, but also, and of course, we want to, by recognizing the month, it helps bring awareness to our community as to what they can do, how we can bring the deaths down, decrease the fatalities due to heart disease, and so we recognize in our resolution those who are working every day to help patients, to educate patients, to prevent the disease, and also to treat the disease after they have this, and to prevent the deaths. We also recognize that these include cardiologists, cardiac surgeons. They include invasive, non-invasive, interventional cardiology, all of the support teams that to treat these heart conditions, including, of course, the specialists, the nurses, the physical or the cardiac therapists. And we recognize as well certain events such as Wear Day on National Wear Red Day on February 2nd, Congenital Heart Defect Awareness Day on February 14, Congenital Defect Awareness Week from February 7th to the 13th, Cardiac Rehabilitation Week from February 11 to 17, and Cardiovascular Week from February 11 to 13. We recognize that the risk factors for cardiovascular disease include some behaviors that can be changed, including exercise, eating, smoking, taking care and controlling your diabetes. And of course, there are some factors such as age and family history that may put a person at risk that are beyond our control. But we want to bring awareness and help those who can control see the importance of bringing this control. And thus we talk about cardiovascular being the leading cause of death on Guam, accounting for 33.9% of total deaths in 2015. So we're presenting this resolution to you, but I'd actually like to take this opportunity, since we have you all on Zoom, to have you mention maybe what you think the public should hear, perspectives as to cardiovascular disease, the seriousness of taking care of it or preventing it, and what they could do and what you're able to do and what you've been able to do for Guam in this regard. And maybe I could start with the doctors from GRMC. I see Mr. Plinsky and Dr. Manaloto. I'm not sure of all the others. Maybe Mr. Plinsky, if you could recognize your team.
Well, I know I see the names. I recognize Dr. Manaloto, of course, are in top center as our Chief Medical Officer, and Dr. Mahesh Gola is our Director of the Cardiovascular Center. He's an interventional cardiologist that joined us full-time this year, and his partner, Dr. Elbabawe, who is also a full-time interventional cardiologist at GRMC, joined us this year as well. I don't know if he's on the call, and I don't see him, but I know our GRMC cardio team, I see a general category. There could be a number of people listening in there, but Dr. Gola and Dr. Manaloto, why don't you tag team and tell us all about what we got going at GRMC and cardiovascular.
Thanks, Eric. I mean, for the cardiovascular health, as the speaker eloquently mentioned, 33% is a big number. About a third of our island is afflicted with the disease, with much more that's not diagnosed. So what we envisioned is that, cardiovascular disease, there's probably no one in the Zoom call or no one even listening in the audience that does not know of any person who has been afflicted by this. It has touched each and every one of our members of our community. And what we hope and strive for at GRMC is that we become the center for cardiovascular care throughout the entire process, right? We brought on our two interventional cardiologists. What we envision is to push the envelope further and maybe bring back, CT surgery, right? Everything related to the spectrum of cardiovascular disease, AAA repairs, things that our people are afflicted with that have to go off island, and to kind of remove that burden so that, we talk about medicine as a healing profession, and in order to heal, you need your family. And I think what we envision is that there will come a day that, as much as possible, our people, uh, and I mean all of our people, can get the care here, be it at GRMC or GMH, that they can get the care here at home, and they don't need to fly out, and that they don't need to worry about the additional stress and anxiety and everything that goes with having to get care offshore, to get everything here, to do the rehab here, to get all the quality care that is delivered in other places to be delivered here at home, and so that they could be in, with their families, as far as being able to heal, recover, and live. Basically, when we talk about two things, right? Mortality is the aspect of people dying, but the other side to it is morbidity, meaning that they may have, for people who have not had the disease, to prevent them. So the smoking cessation and the lifestyle interventions, but more importantly, if they do have the disease, trying to minimize the impact on them medically so that they can live a longer, productive life with their families. And as far as the technical stuff, I'll leave it to the man himself, which is Dr. Gola, if he wants to add a few things.
Thank you, Dr. Manaloto. Dr. Gola?
Hey, Speaker Terlaje. Thanks for having me. It's a great opportunity to share my thoughts to the people of Guam. I've been here, quite a bit time, close to 6 months now, and I learned a lot about people of Guam and the complexity of the, coronary artery disease, like, heart attacks and related deaths. I was reviewing the data recently too. Apart from the mortality, almost compared to 2000 to 2019 statistics in Guam, there's a 59% hike in cardiovascular mortality related deaths. If you look at any state on the mainland or any disease, either infections or non-infectious disease, this is extremely high rate but related to cardiovascular related deaths. Like every disease, prevention is better than cure, so people needs to be educated, like, in terms of lifestyles, what they can eat, what they're supposed to do, and what kind of screening test they can get before the disease is even worse, so that we can catch these, cardiovascular diseases earlier, so that we can treat it in a preventive measures. I think it's too vast to start from, like, how we do that, but briefly I can tell the main focus of cardiovascular disease in coronary artery disease, in medical terms, in general terms, there is a blockages develop in heart arteries which supply the blood to the heart muscle. Imagine heart is like a pump, a mechanical pump. Pump needs a gas, right? So there are tubes, the plumbing system supply blood to the heart muscle. But over a period of time, due to various factors, these tubes or a plumbing system of the heart create or develop blockages, mainly consists of cholesterol or scar tissue and calcium. Once they block these arteries, and then people develop various presentations. Some patients develop chest pains. Some patients develop like a shortness of breath when they walk. Some patients do have dizziness. Some patients presents with a severe chest pain with a major heart attacks. So first thing is awareness of these symptoms so that people can come to primary care physician. Eventually they get screened. So anything, any heaviness, chest pain, any like inconvenience, like indigestion from jaw to the belly button, anything related to the heart. It could be heart pain. So needs to be evaluated. So people who have a high risk for these heart attacks are people who are having high blood pressure, diabetes, high cholesterol, people who smoke, and people who do have obesity and family history especially, and some kind of rare etiologies as well. But these are very common risk factors how people develop heart blockages, result heart attacks and related deaths.
Thank you.
So to prevent these blockages development, so one should focus on all the factors. Some things we cannot control. Let's say an example, family history. So we can't change our parents, right? So we gotta carry the genes. So those populations should be screened earlier. Like if anyone, now mother side, father side, if they have a family history of heart attack or early stenting or a bypass surgery done in their family, let's say men 55 or women 65 years of age, so better they go to primary care doctor and get their lipid panel, cholesterol panel drawn, or appropriate screening done, and if they find something, treat it, especially with a cholesterol pill called statin.
Thank you so much, Dr. Goel, and thank you so much for all your work and for pointing those things out to us today. And I'd like to also recognize GMH, and if Lillian, if the CEO is there, she could recognize her team, or Cynthia, if you'd like to recognize the team. I see we have the cardiac rehabilitation, we have the nutritionists and others here. So if you could.
I also see Dr. Alex in the room along with Ms. Lillian and several of our executives. So I'm going to turn it over to them.
Thank you. Thank you, Madam Speaker, for giving us this time to then highlight and heighten the awareness and hopefully the education with regards to heart disease. But I'm not the expert. Dr. Alex is the expert. So I'm going to let him speak a little bit more about the cardiology services that he's such an expert in.
Okay. I'll be brief, but I'll make it divided in two sections. One prevention and the other one treatment on the island. In terms of prevention, I think the major issues are diet, which is a chronic issue, and the second issue is drugs, which is actually a relatively new issue. And we have meth epidemic that we have had now for 9-10 years, but it's getting worse. So these two issues should be we should try to address them as much as we can. On the other side is treatment, and on the side of treatment there are two obviously major issues that we would like to address, or I hope the island will be able to address in the next few years. So one is cardiovascular surgery, and the other one is electrophysiology. So these to me are the major issues on the island. Prevention on one side, the two major factors being, in my opinion, diet and drugs, which is really a new factor, and then treatment, cardiovascular surgery, and the EP. Thank you.
Thank you, Dr. Alex. We do have our team, like you recognize, Madam Speaker. I don't want to take too much time because there are quite a bit of us who participate in this cardiology service to make it really available for the people of Guam. So thank you again for this time.
Okay.
Madam Speaker, you're on mute.
Thank you. All of you from GMH for your work, and I know it takes an entire team, including every part of your staff and the nurses and the other specialists that treat a patient and rehab a patient after surgeries and after other procedures. and that we are all hoping that we are going to get the highest standard of care for cardiovascular disease on Guam and for all disease. So I thank you for your hope in that and your work towards that as well. There is one paragraph in our resolution that discusses that certain cardiovascular risk factors are more prevalent in women from certain racial, ethnic, minority backgrounds, including factors such as hypertension, obesity, and diabetes, and that gestational diabetes and preeclampsia, as well as non-traditional psychosocial risk factors like depressive and anxiety disorders, increased child care, familial and home care responsibility have been shown to increase risk for cardiovascular disease in women more than men, and disproportionately affect women from racial, ethnic, minority backgrounds. So I know that all of you are serving with the same population in general, and that you have seen these significant challenges. So I thank you for pointing out, in particular for Guam, how we can help and help educate. And we will work this month and always, right? Continue to do so. So again, this resolution is to commend you and to thank you very much for your work, in addition to bringing awareness to cardiovascular disease in Guam and the risk of death from cardiovascular disease in Guam and the ways to prevent cardiovascular disease in Guam. So Sizuzmasi again to the teams from Guam Memorial Hospital Authority and the Guam Regional Medical City on the occasion of American Heart Month during the month of February 2024. And we commend you for your commitment to promoting heart-healthy lifestyles, expanding access to quality health care. Sizuzmasi. Have a great day. Thank you.